Cardiac Autonomic System CANS504. Connect the mains cable back of the machine and other end to the power socket. Connect the ECG cable, BP cuff connectors, Valsalva hand grip at the appropriate slot. Software installation. Place the software CD in the CD drive. Select the My Computer on the desktop and select the CD drive. Then you will get the following screen. Now select the new CANS to install the software and the following screen will appear. Select the setup file with monitor icon and the following screen will appear. Select Next menu for further installation. The following screen will appear. Select Finish menu to complete the installation. Performing CANS test. After the installation is over, an icon New CANS is created in the PC desktop panel. Execute it by double-click of this icon. The main page will appear. In order to connect the PC with CANS unit, a communication port is to be selected. Select the COM port menu on the toolbar on the screen. When selected, a menu displays available COM port as 1, 2, 3, 4, etc. Match the port number depending upon the port number of the PC. Only when the correct ports are selected and matched, the CANS unit is electronically connected to the PC. Select OK and exit. If they are not selected properly, then an error message, communication error, will appear on the screen. We are using plain A4 size white paper for printing, and to have the hospital name and address as the header, we need to enter the details. Select the hospital menu in the toolbar appearing on top of the screen. By default, you will get MES Hospital. Modify them with your hospital name and address. If you do not require the header to be printed, or if you are using a pre-printed letterhead, then deselect the header required box. If you wish to add your hospital logo, then use the logo path and point the logo in JPEG format stored in your PC. After all these, save and exit to come out of this menu. You may add the name of the consultant by using the consultant menu in the toolbar. Select Add. Enter the name of the consultant. Example, Dr. E. Ramalingam. After entering the name, select Specialization. Type the specialization. Example, Consultant Diabetologist. If you wish to add more consultant, repeat the procedure. Otherwise, select Save and exit. If any consultant or doctor who is referring patient regularly, you may also add their name using the referral menu in the toolbar. The procedure is similar to adding consultant name. All the above settings are one-time setting and need not be redone every day. The software is completely installed and ready for use. Use the new menu in the top of the toolbar for entering the patient details. Every time we do a test, we have to select New to complete the test. Enter patient name, user ID, sex, age. Select the name of the consultant if there is more than one. Save the patient details using Save key. Fix the ECG disposable electrodes to the ECG button cable. Stick the disposable electrodes, which is attached to the patient cable, to the patient. Note the color code of the button cable. Red button with electrode to be fixed on the right shoulder, green button with electrode on the left side lower abdomen, and the black button with electrode to be stuck to the lower right abdomen. If the patient has got hair in these areas, slightly move to the place without hair. Alternatively, shave the hair to fix the electrodes. Electrodes fixed with hair may not give proper ECG signal and the output may not be perfect. If the patient's skin is too oily, then clean with a clean swab with alcohol for better contact. After fixing the electrodes, tie the belt provided with the cable around the patient to avoid electrode displacement while doing the test. Resting ECG test. The patient should be in the resting position for this test. Select resting button to take 1 minute ECG in resting position. Patient should not move or talk while the test is progressing. The live ECG will appear on the bottom of the screen, and make sure that the peak of the ECG signal should be more than the red marker line on the left side corner of the ECG screen for better results. If the height is less, then increase the gain switch on the front panel from 1 to 2. The signal is amplified twice the original signal. Even after this selection, the ECG signal is small. Then modify the electrode position on the patient body. You may bring them closer to the heart for better signal. The ECG signal will automatically stop after 1 minute of ECG capturing and recording. Deep breathing test. Patient in supine position, and they should be explained about the test. Patient should inhale deeply and then exhale deeply, such that he does 6 cycles of inhalation and exhalation in 1 minute. That means they should inhale for 5 seconds and exhale for 5 seconds continuously. Select deep breathing button to take 1 minute ECG while the patient is in deep breathing. Supine ECG test. After the deep breathing test, ask the patient to be in supine position and breathe normally before doing the standing ECG. Select supine button to take 1 minute ECG in supine position. Patient should not move or speak during every test. Standing ECG test. Always keep a rubber or wooden platform or mat near the patient couch and ask the patient to stand on this platform or mat. Immediately after he stands, select Standing button to take 1 minute ECG in standing position. Patient should not move or talk during this time. Valsalva test. After the standing test, ask the patient to sit on the couch or on an armless chair. Instruct the patient about the Valsalva test. Ask the patient to hold the mouthpiece tightly between their lips. Ask the patient to take a deep breath and blow hard till they reach 40 mm Hg pressure and hold it continuously for 15 seconds. Select Valsalva button, and after few seconds of normal ECG, the patient has to perform the Valsalva test for 15 seconds. When the patient starts blowing, the pressure value is displayed boldly, and the moment the patient reaches 40 mm Hg pressure, the ECG waveform turns to pink from green, and also a red box turns green. The Valsalva hold time is also displayed. When the patient stops blowing or blowing less than 40 mm Hg pressure, immediately the ECG waveform turns green, indicating the end of the Valsalva test. Allow the ECG to stop after a minute. If the patient is not able to blow and hold for 15 seconds, then they can do their maximum possible time. At least 5 seconds they should perform. Otherwise, the interpretation may become wrong. End of this 1 minute ECG, you may get a dialog box asking the operator to accept the test or not. Depending upon the performance, the operator may decide on this. BP supine test. Tie the BP cuff on the upper arm of any one hand. The arrow mark should be on the brachial artery for accurate result. Select BP supine button to take BP in supine position, and during this time the patient should be in supine position. The built-in noiseless pump inflates the cuff, and the cuff pressure values are displayed boldly. After detecting the systolic and diastolic pressures, the cuff is deflated automatically. BP standing immediate. Ask the patient to stand straight and should not talk or move. Immediately on standing, select BP standing button to take BP in immediate standing position. The systolic and diastolic BP are measured. The counter clock will count up to 60 seconds, and after 60, the BP is taken automatically. This completes the BP after 60 seconds. Sustained hand grip test. The patient should be in resting position. Select BP before hand grip button to take BP when the patient is in supine position. Give the hand grip to the patient, and he should not hold the hand grip by the same hand where the BP cuff is tied. He should hold it in the opposite hand. Ask him to apply his maximum pressure to compress the grip. He should do it in the opposite hand. Select maximum pressure button and ask the patient to squeeze the hand grip with maximum possible pressure and hold it for at least 5 seconds and then release. Computer will sense their maximum grip and displays both maximum grip and 30% of the maximum grip. Select 30% of hand grip button and ask the patient to squeeze the hand grip till they reach the 30% of the maximum pressure value, which is displayed on the screen. The pressure value is indicated boldly on the screen. Once reached 30%, a green button indicates the correct pressure. Hold it till the BP is measured after 5 minutes. Note, the patient should hold the hand grip on the hand which is not tied by the cuff, and he should hold the hand grip horizontally. He should not rest the hand on their lap. After completing the CANS test, select the waveform menu in the toolbar to check whether all the ECG waveforms are neat and free from any noise. Select the Preview menu in the toolbar to view the final patient report to be printed. The first page shows the 1-minute waveform of all ECG taken. Preview page 2 shows the final interpretation to be printed. After seeing them, select Print command on this page to complete the printing.